Hello, my name is Bailey Brown, and I will be discussing the topic of improving therapeutic communication in psychiatric nursing through role play. This topic is of importance to me because I have been a psych nurse for the past 4 years, and I notice the types of situations where therapeutic communication would make a difference. I believe education is lacking regarding therapeutic communication, as well as the fact that nurses do not receive enough training on how to interact with psychiatric patients. The purposes of this prospectus include educating psychiatric nurses about the significance of therapeutic communication, providing nurses with an opportunity to see the world from psychiatric patients' view through role play, and using role play as an educational tool to increase knowledge and confidence levels regarding therapeutic communication. Working alongside other nurses has opened my eyes to the fact that nurses lack appropriate communication skills, yet I don't believe they realize it. I struggle with communicating therapeutically sometimes myself because it's easily frustrating and mentally exhausting while working with patients who have a mental illness. However, even though I may not always communicate therapeutically, I have not lost sight of the fact that it's paramount to understanding and caring for patients with a mental illness. This study is significant because it will reveal the importance of communicating therapeutically, as well as allowing nurses to reflect upon their own communication skills when they have the opportunity to use them during role play. Nurses may not see their need for improved communication skills due to being too busy to notice or to see past the stigma that psychiatric patients carry. These patients are vulnerable, they have poor coping skills and altered thought processes. They experience depression, anxiety, paranoia, mood swings, active hallucinations and delusions, all of which may potentially lead to escalating behaviors such as aggression, attempts to harm themselves or others, and disrupt a milieu. Communicating therapeutically, however, helps to build a rapport with these patients as well as establishing a trusting relationship with them. I have personally witnessed how beneficial it is for both nurses and patients when communication is the center of any problem. The research problem statement reiterates the fact that therapeutic communication is paramount when caring for patients with a mental illness. Since that has been made clear, the difficulty is getting nurses to realize the need for improvement in order to benefit the patients. It can be told to nurses all day long, and they may frown upon having difficulty with it. But I believe role play would be an excellent tool to allow nurses to learn more about it in general. Modeling and role modeling theory by Helen Erickson correlates well with what this prospectus is trying to accomplish. Modeling has been viewed as gaining an understanding of the client's world from the client's perspective. If nurses attempted to view the world the way patients with a mental illness viewed it, they may have more compassion and see the need for better communication. It's much easier to gain an understanding of their needs if you would take a few minutes to try to see their side of the story, and that allows nurses to view their world. Role modeling is the actual intervention part, which allows nurses to plan patients' care around their needs. I found several articles to support the use of role play as an educational tool. Also, several articles discussed how to communicate therapeutically and to improve the importance and advantages of it. One in particular study measured self-efficacy of a group of 38 nursing students' communication skills using high-fidelity human simulation, or a SIM-man. Self-efficacy was defined as one's belief in capabilities to overcome successfully the demands of a situation in order to achieve a desired outcome. Nursing students were asked to interact in situations mimicking psychiatric patient scenarios where they communicated and took on the role of the nurse in each situation. An instructor acted as a patient by speaking through the computerized mannequin using a microphone headset. Overall, results were positive and suggested future use of high-fidelity human simulation. That was a form of role play used to educate that sample of nurses through their reflection of the way they interacted with the patients in that scenario. Another article actually discussed psychiatric patients' responses about their needs, which included better communication from nurses. They expressed feeling the need to be better understood and mentioned how nurses could accomplish that if they would try to communicate with them and see things from their point of view. Role play as an intervention is the independent variable in this study. According to a source, role play is designed to reflect the interaction between a care provider and a patient in order to implement the expected therapeutic outcome. Perceptions of nurses' knowledge and confidence levels regarding therapeutic communications are the dependent variables. Therapeutic communication is defined as the face-to-face process of interacting that focuses on advancing the physical and emotional well-being of a patient. The research questions applicable to this study are: will role play serve as an educational tool for the explanation and importance of therapeutic communication? And will the sample of nurses gain more knowledge of and confidence in their therapeutic communication skills post-role play? This study's design is quantitative and quasi-experimental. Pollitt and Beck refer to a quantitative study as one consisting of numeric information that is obtained from a formal measurement and is analyzed statistically. And quasi-experiments involve an intervention, but they lack randomization. Assumptions, limitations, and delimitations exist in most, if not all, research studies. In this study, it is assumed that nurses will have an increased amount of confidence in their communication skills after role-play scenarios are completed. It is also assumed that nurses will give truthful feedback at the end of the study. There's no certainty behind the truthfulness of their responses, however. Limitations include the small sample size, which includes only 40 nurses, as well as the fact that the study takes place in only one psychiatric facility in Mississippi. A delimitation of this study includes the fact that only nurses working at a psychiatric facility make up the sample. Any type of nurse could participate in the study, as well as other non-nursing employees working directly with psychiatric patients, but only registered nurses working with psych patients will be asked to participate in this study. In this study, it will be based on a sample of 40 registered nurses working at a psychiatric facility in Newton, Mississippi. Prior to the study, permission from the CEO at the facility will be obtained. Participants must give consent to participate. No actual names or information of patients will be involved in it. Over a course of 2 weeks, 3 different scenarios will be acted out using role play. Actors will consist of volunteers working at the same facility. Volunteers will be made up of mental health technicians who actually interact with psychiatric patients on a daily basis. Each scenario will be scripted by 2 different nurse managers and the volunteers. One scenario will consist of an actively suicidal patient, one will consist of an actively hallucinating patient, and one will consist of an aggressive patient who's proceeding to escalate. The actors will rehearse prior to each scenario. The sample of 40 nurses will be broken down into groups of 5. One group per day will participate in each scenario. Each nurse in the situation will take on a role of the floor nurse, assuming it was an actual situation on a unit in a psychiatric facility. In each scenario, the nurse will proceed to communicate with the patient while attempting to de-escalate the situation. After each scenario, the nurses will join their assigned groups along with 2 nurse managers in a room which is assigned for debriefing. They will reflect there on how they handled each situation. Proper therapeutic communication techniques will be discussed, as well as appropriate ways to avoid further escalation. The data will be collected using 2 different visual analog scales that will measure nurses' own perceptions of their knowledge and confidence regarding communication with patients. They will rate this on a visual analog scale before and after role play and debriefing are completed. Also, they have to complete a questionnaire containing a Likert scale after role play and debriefing are completed. It will consist of questions and statements regarding the experience, whether or not it was helpful, and whether it should be used as an educational tool for nurses. Data will be analyzed using coefficient alpha or Cronbach's alpha to determine internal consistency of the results. Also, reliability of the results will be determined to decipher whether or not role play as an intervention is successful enough to use an educational tool for nurses requiring further education on how to therapeutically communicate. The following references were used in this study as well as a few others. Overall, I would like for nurses to understand the significance of therapeutic communication because of the beneficial aspect it has on patients as well as their treatment goals. I believe role play could be an exceptional way to explain this, as well as giving nurses the ability to see what life is like from a patient's standpoint. Thank you.